Welcome, everyone, to today's webinar, Dental Leaders Who Made Transformational Decisions in 2020. On behalf of Becker's Healthcare, thank you for joining us. Before we begin, I'm going to walk through just a few quick housekeeping instructions. So we will begin today's webinar with a panel discussion, and we'll have time at the end for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you don't see your slides moving or have trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. So with that, I'm going to ask each one of our esteemed panelists here to briefly introduce themselves and briefly share some big transformational change their organization made in 2020. And we'll, of course, dive into that deeper throughout our discussion today. But Ken, do you want to get things going here with the intros?
Sure, Brian, I'd be happy to. And thanks for having me. I'm excited to be here. My name is Ken Kaufman, the CFO of Community Dental Partners. And for us, the big transformational change that we wanted to address was to be open as soon as we possibly could. Once COVID hit and practices started to close down, we wanted to stay open for emergency procedures and then expand those services as quickly as possible. And our number one concern was, how could we create an environment that our patients would feel safe coming into? And so I'll get into more details later about some of the things we did there.
Excellent. Well, thank you for being here, Ken. Lisa, why don't you go next? Lisa, you may be on mute there.
Thank you. I was. Good afternoon, everyone. I am the Senior Director of Revenue Cycle Management at Sage Dental down here in Boca Raton, Florida. And the biggest transformation we made was to add artificial intelligence and teledentistry, things that we were looking to do, but we sped up the process.
Absolutely, absolutely. Nothing like a crisis to make you speed up the adoption of technology. All right, thank you for being here, Lisa. Barb, you want to go next?
Hi, I'm Barb Krug, and I'm the practice administrator for Web Orthodontics. And one of the biggest things, I'll echo Lisa, is the use of artificial intelligence and teledentistry. We just moved into using different types of technology a lot more quickly than we would, so we could keep in touch with our patients as well as our team while we were out for COVID. And I can go into more details as well.
Yeah, and we certainly will. And definitely some themes emerging here along the teledentistry and AI for sure. Norton, why don't you go next?
Sure, thank you. And thanks for including us in this important discussion. ProHealth Dental, I'm the CEO of ProHealth Dental, and we're a little different than most of the dental organizations you probably come across. While we look a bit like a DSO, our model is unique in that we partner with large medical groups and hospital systems and, in effect, become their dental, or as we prefer to call it, their oral health service line. So we are based here in the metropolitan New York area. We are currently partnered with 4 large medical groups and 1 large health system, collectively servicing well over 3 million patients that they are now offering oral health services to. So the transformational change for us from COVID was really to allow us to showcase the importance of dentistry or oral health as an essential healthcare service, because that's how we see ourselves as a healthcare services organization and not really as a DSO. And be happy to go into detail on that later.
Yeah, absolutely. I think that's a fascinating point, and I appreciate you being here to share your unique perspective as well. Brian, I want to rephrase this question slightly for you. So Rectangle Health, works with a lot of dental providers and some of the largest DSOs across the country to implement patient payment and engagement solutions. From that perspective, can you share some of your clients' big transformations?
Yeah, absolutely. Thanks, Brian, and thanks for helping put us all on this great conference, and we appreciate it. I'm the Vice President of Rectangle Health. Like Brian said, we do work with the full scale of dental practices, and what we've seen our clients really implement, like some of the panelists have started to talk about, is telemedicine. So what we want to do at Rectangle Health is provide technology to make for a better patient payment experience and engagement experience through this entire journey as COVID has continuously changed the market. So what we've seen is a number of things, mainly going fully contactless. What we mean by that is text messaging, emailing, digital registration, card on file, recurring payments. The features that we as consumers use in our everyday life, think of Uber and Netflix, we have brought that technology across the entire scale of dentistry for our clients. And that has been the number one feature that we have seen since March of 2020.
Absolutely. Thank you for sharing that, Brian. That contactless piece is, of course, so important to the conversation we're having today. So then I want to dig deeper here on the points our panelists just shared. So what actions did you need to take in order to put this transformation in motion? And maybe what were some of the challenges you had to overcome? I can think of a few, but one example that comes to mind is, did you need to engage with a vendor? Did you need to, another one, maybe reallocate some funding, reassign team members, communicate to patients differently? I mean, there's just a host of challenges that can go into some of these efforts you all have undertook last year. Ken, I want to circle back to you to kick things off again here.
Sure. So with a focus on trying to create an environment where the patients would feel safe. If you remember, the middle to end of March, when COVID started to become, recognized as this global pandemic, and different governments were taking different actions around it, there was a lot of fear and there was a lot of concern. And right from the very beginning, we knew that the practices we supported very much wanted to be open as much as possible and do as much as possible to contribute as really the top of the entire healthcare stack in terms of helping make sure patients were getting the oral health care that they needed and avoiding, putting a load on the hospital systems or compromising their immune systems in any way and making them more susceptible to the pandemic or anything else related. And so as we started to look at what could we do to help both our employees and the doctors, as well as patients, feel safer, we decided to create a brand new position in every single practice that we support. And we hired a full FTE extra in every single location. And we gave that job, we titled that job Health and Safety Advocate. And their job was to stand in the lobby, and when patients came, they would check them, they would meet them at the door, go through the health questionnaire, take the temperature. If they wanted to wait in the car, they would coordinate so that they could wait in the car. If they wanted to wait in the lobby, they would make sure that they had somewhere to sit that would be, physically distanced appropriately from everyone. And when this individual, this health and safety advocate, did not have a patient that they were specifically interacting with or a family, they had the wipes out and they were going around and cleaning everything in the lobby, the chairs, the door handles, the doors themselves. And they full-time, all they did was interact with the patients and in that check-in process and then clean. Now, it's the cleanest the lobbies of these dental practices have ever been. And we certainly got a lot of very favorable comments from the patients. But we found that it was received so well because everybody was just nervous and afraid of COVID, and they came into an environment where they could see that our clinicians were taking very seriously all safety precautions. Dentistry already is phenomenal at infection control. This was a way to help the patients feel even more confident that they could come into this environment and not contract, this global pandemic that everybody was afraid of.
Thank you for sharing that, Ken. So important that as soon as they see the facility, they just feel more comfortable. That's excellent to share. Lisa, I want to go to you next. Can you talk about, can you address this question from your perspective?
Sure. So at Sage, we were already looking into artificial intelligence and teledentistry, but of course we had to speed it up. So we did, which was great, and it turned out really well. Right now we're using iPads to do treatment plans and collect the patient portion in the chair. We added dental monitoring, which is this great opportunity to monitor ortho patients from home, where they can use their cell phone and send images to us, and it actually can reduce their visits to the office. So again, we're more touchless. It can reduce by half or even more. It's phenomenal what this can do. And I think it gives the patients a sense of comfort that they're not going into the office as often. It's certainly more convenient. We added online bill pay, text to pay. And I think one of the challenges we had was educating our patients, advising them what we were doing and why, and getting them to buy into some of the artificial intelligence that we've been bringing on. They're a little skeptical, does it work? But we're making a lot of progress there.
Excellent. Thank you for sharing that. The patient education piece I find particularly fascinating, just because it's just across healthcare, such an important conversation a lot of leaders are having right now. Could you share even a little bit more than that before I pass it off?
Well, we've added another product called Pearl, which can scan a patient's mouth and also treatment plan and diagnose when they have issues, whether it's perio or cavities or any kinds of infection. Again, it's getting the patients to buy into the technology and teaching them. What Pearl does for us is it gives an unbiased diagnosis. So they're not feeling as if the dentist is, trying to work some kind of treatment plan out of them that they don't really need. But it's touchless. So again, it's super exciting right now. We wanted to do all of this, but we had to speed it up, and I think it moved us probably years ahead in what our financial plans were.
Yeah, thank you for sharing that. And a lot of clarity on the communication with patients, right?
Yeah, a
Barb,
lot.
Barb, let's turn to you next.
Okay, and I'll kind of piggyback a little bit on what Lisa said as well, is that as soon as we shut down last year, our patients wanted to know, what was going to happen with them. In orthodontics, they're used to being seen every 6 to 8 weeks, so they were definitely concerned about how we were going to keep monitoring things with them. We were already using text requests and texting a lot with our patients, doing care calls and things like that. But we knew we needed to do more. So we had already looked into using AVA from Dentma. So we upgraded that so that we could actually do virtual exams with our current patients. We found that most patients did not want to do a new patient exam while we were shut down, but our current patients definitely wanted to be seen and be taken care of, so to speak, which definitely helped with other things as well, because typically ortho patients are on a longer contract. So those monthly payments were already coming out mostly on auto pay. And knowing that we would be able to take care of them and see them was going to help practice as well maintain our cash flow. So we used that. We also, once we came back, we did not have anyone but the patient coming into the office. So what we did was we would set up a Zoom link so that we could talk with the parent during the entire time the patient was in the chair. And we're still doing that, as so many parents work and are not necessarily able to be with their children during orthodontic appointments. It's been great for us as a way to have that instant communication at the chair. So we're continuing to do that. We also we did a little bit of DocuSign for all of our financial documents. This sort of caused us to take the plunge, and everything is now with DocuSign that we can send, so we're not having people stop at the front desk and deal with all those sorts of things. We developed a lot of those protocols for when a patient checks in, how they need to walk through the office, and just to protect staff and patients during the pandemic. And I think most people were really appreciative of all of those things. We as well also ended up hiring someone to do just all of our patient check-in, do our COVID screenings and all of that, so that we could still maintain our patient flow.
Thank you so much for sharing that and walking us through all those steps you took. Norton, why don't you go next?
Sure. Well, of course, we had the same challenges as everyone else, the financial challenges, the challenges associated with furloughing and then rehiring staff. I think that in general, what we needed to do, like everyone else, is to comfort our staff, comfort our patients that coming to the dentist is safe, and we hired additional staff like everyone else did, and we did go to teledentistry as well, so we could stay in touch with our patients, provided emergency services as needed in each of our offices. But I think that the one thing in terms of actions that we took that made this transformational for us, again, goes back to our differing model. We use the concept of frontline workers, which was everyone was seeing in the news as being so important in addressing COVID, and we decided that our frontline healthcare workers were going to be our hygienists. And what we did was we expanded their job descriptions to go beyond just the routine hygiene visits or the additional services they provide. And we added an entire barrier of different screening tests that they would provide, medical screening tests. I mean, so beyond the usual oral cancer and the like, we added blood pressure, pulse ox, we do cardiac EKGs, we do sleep apnea screenings, and this is all done as part of the hygiene visit now, because we believe that it reinforces the message of oral health and overall health being so closely linked. It also is a vehicle for us to reinforce the relationship that we have with what we call our clinical affiliates, so that now someone comes to one of our offices, they get these screening medical tests. If there's an abnormal reading, we make them aware of our clinical relationship with these large groups or hospital systems. So patients are now looking at going to the dentist as a bit more of a seamless approach to taking care of their overall health, more of a holistic approach, consistent with our tagline, which is, put your health where your mouth is. And we think that it's really resonating. We did a lot of what I guess I would call infomercials to educate the public about why medicine and dentistry should not be practiced in silos and the importance of coordinated care. And we are working towards an integrated medical record with our clinical affiliates to allow for exchange of information, and just as importantly, to allow for scheduling for where we can schedule patients that are in need of medical specialists, and likewise, when a patient goes and sees their primary care physician and is asked for the first time, when's the last time you went to the dentist, that if they're in need of a dentist, that they can schedule and come with us as their affiliated dental practice. So it really allowed us to look at you never want to look at silver lining on things like pandemics, but it really was a silver lining in the sense of seeing how people are much more focused on health than they ever have been before. And for the first time, looking at taking care of their mouths as an important part of being healthy.
Yeah, some really fascinating comments around care coordination there. I think that's one thing the pandemic exposed is sort of the fault lines and the cracks in the healthcare system, and really trying to integrate dental care into everything else and reduce those silos is so important. So thank you for sharing that.
Thank you.
Brian, I want to turn to you now, and can you speak to some of the steps that dental providers you work with have taken to implement new payment technologies?
Yeah, absolutely. And kudos to the four panelists that what they did was outstanding. What we want to do at Rectangle is make that transition from in-clinic to virtual streamlined and seamless. And what we wanted to do is make it touchless, most importantly. So what we did is, that fear factor was real in the beginning. We wanted to digitize everything, from the registration forms to the payments, even to the in-clinic back and forth. We don't want the patient to have to hand anything over anymore or print paper out. That back and forth was completely eliminated, and we did it via technology. The biggest concern we heard during this whole conversation, like Lisa touched on, was patient education and really patient adoption to these technologies. It's funny because in our everyday life, we use these things. If If you buy a house, there's DocuSign. If you go to a restaurant, they take your card to hold your reservation. But for whatever reason in healthcare, it just wasn't commonly used. So what we wanted to do is go out and tell the patients, again, we like technology. So whether it's text messaging or emailing saying, hey, your appointment's coming up, please wear a mask, and here's your patient plan for the rest of the treatment. We wanted to bring that technology at no capital expense to our clients to make during this time a very efficient back and forth between the patient and the provider. And what we saw is adoption rates really spiked. Text to pay, text, anything via our cell phones. We all have our cell phones on us at all times. That became the number one way to push this message out there. And we are seeing a massive increase in the adoption rate of these technologies. And it all spurred during that first week, 2 week, month of COVID.
Thank you, Brian. Yes, it's sort of fascinating, right, how comfortable we are with these technologies in our everyday life, but how it just hasn't come to healthcare in the same way. But, that's obviously changing now. So I want to ask then if we can drill down and talk about really some of the benefits these transformations have yielded. Ken, I'm going to turn back to you.
Sure. So we saw a few things. The objective was to try to create this very safe environment, and where not only was it already safe, but where the patients would see things happening that would help them feel more confident in the safety that and precautions and protocols that were being followed. We found that our relationships, I should say the clinicians and staff relationships with the patients improved. They were grateful for all of the activities that they saw happening and thanked us regularly. Or I should say, thank doctors and the staff regularly. In addition, what we didn't anticipate completely, because I think our culture is so ingrained that everyone just acts and behaves according to the culture already, or they make efforts to do so. What it really did, it revealed how well penetrated the culture was within the entire organization, as people responded, obviously very positively to creating the most safe environment possible for the patients to come into. And as they cared about each other and they looked after each other and made sure that everybody was well taken care of through the process. And again, Norton mentioned the furloughs and the layoffs and all of those sorts of things. The actions that we took revealed and I think strengthened the overall culture of our organization, which is we try to create an amazing doctor, patient, and staff experience. And so those are just a few of the benefits that come to mind.
Thank you so much for sharing that, Ken. It's really fantastic work that you've been doing. So I appreciate you being here and sharing all that. Lisa, let's go to you next.
Thank you. So we were open during the pandemic. We had about 20 some offices open. So we continued to treat our patients and take care of their oral health and, of course, emergencies that came up. We saw a huge shift in our company culture and I think in our patients' appreciation of what we do for them. Everyone in the company, I mentioned this on our last call, everyone in the company got a T-shirt that says, not all superheroes wear capes, some wear scrubs. And it really made the providers feel like they were appreciated and they are the frontline workers. So nothing but positive has come out of this. It's amazing. So we've also seen a spike in our patient appointments and patients coming in and coming to Sage. So we feel like, we acted quickly. We were available to people right away. And internally, we've all bonded together. So it's been a very positive experience.
Thank you for sharing that, Lisa. Definitely, the appreciation factor is so huge, especially when, folks are being asked to work through some of this stuff. It's just hard,
Yes.
Me, comfortably, I can be at home. So I definitely appreciate the work that the front lines have done throughout the course of this pandemic. But Barb, can we turn to you next?
Sure. I was going to say when the shutdown occurred, we had a very large staff. So we knew that keeping them engaged was going to be very important, especially because we felt like information changed rapidly as we went through this process, what we learned more and more about COVID and how we needed to deal with it in the office. So we implemented weekly Zoom calls with all of our staff that were laid off at the time. And we also did the GroupMe app so that we could chat and we could keep in touch with each other. And I think that kept everybody in the loop and everybody felt like they knew what was going on. One of the biggest things was we kind of went back to basics. We went back to scripting so that staff were comfortable in what they were going to say to parents. It didn't have to sound canned, but they knew exactly what to say if someone asked them a question or how the office was dealing with something. So I think that gave them a comfort in that as well. And then, just keeping up with our patients. I think our patients were very appreciative of all the care we took to keep in touch with them. And then once we opened again, everything we did to make them feel safe and to give them as much information as they could get from their appointments. I just think keeping everybody engaged and informed and doing it in a very organized way was good for both the team and all of our patients.
Excellent. Thank you for sharing that, Barb. Yeah, the communication piece for both staff and patients, right? Just feeling that interconnectedness, that togetherness, so important. Norton, we'll turn to you next.
So I think for us, we're a very mission-driven organization, and this gave us the opportunity to reinforce that mission in terms of looking at oral health as an important healthcare discipline, an important healthcare service. It really helped build culture within the organization because, again, everyone was very focused on their health, their family's health, their friends' health, and then if we could add to that by making them understand that there was a missing piece that was going to be important for them staying healthy, namely taking care of their mouths, that we were contributing to that mission, which added to the culture. And everyone in the organization really felt and saw a difference. The clinical literature, as you may be aware, has come out fast and furious about correlations between poor oral health and many systemic and chronic diseases. And there were a number of articles specifically dealing with COVID and why it was so important to maintain a healthy mouth to either reduce or protect against the consequences of COVID. I think that overall we saw this as something that, again, just reinforced our mission. We also did something that we were very proud of, which was we worked with the Harvard School of Dental Medicine as part of their oral health initiative, and actually working with our clinical affiliates for their primary care patients. We did a survey on patient awareness about oral health, and we saw that there was a tremendous receptivity on the part of those patients to understanding more about how they could be healthy and stay healthier. So we think that the benefits have been to really, as I said, reinforce our mission and our model.
Yep. Reinforcing the mission and the model and really learning more about the patients too, all taking advantage of all that. Yep.
Absolutely.
Excellent. So Brian, then, I think it's fascinating how much about this is really focused on communication and this communication component of being able to do it digitally, remotely. So I'm really curious to, hear what you have to say about benefits with regards to this, the capacity for remote engagement and payment.
Yeah, absolutely. And each panel has kind of layered this in, but we saw a strengthening of relationship between provider and patient. There is a direct correlation between patient satisfaction with their registration, with their payment experience, and revenue to their provider. So what we've seen across the board is a reduction of paper statements, a reduction of calls to the practice, more revenue to the provider, a lower AR or faster turnaround of that AR. And that all stems from that patient satisfaction with all of the steps that these providers have taken. So again, it's imperative to make sure that the patient likes what is in place, and the numbers are stating that they do. So that strengthening of relationships has been really cool to see, and it's across the board. It's a pretty powerful story to tell.
Absolutely. Definitely widespread and fascinating to hear about. Thank you, Brian. So I want to, the next question here, there's probably a lot of folks listening to this, watching this right now, or thinking about taking on some of these transformations. So that brings me to this question, which is, can you talk about sort of lessons learned here? Any advice or tips that would help others sort of thinking about making similar transformations? Ken, we can start with you again.
Sure. This is going to be somewhat of a big picture comment, I think, on this. But obviously the things we did were just a function of it. I was surprised. I was shocked, actually, when all of this started to happen and you had global and national and local governments and authorities saying that dentistry is not essential. And I was surprised to see how many dentists, and I'm not a dentist, I'm a business person that works inside of a DSO, and our job is to support dentists and do everything we can. I was surprised at how many dentists said, yeah, you're right, we're not essential. And they kind of packed up their things and went home. That was kind of scary in many ways. But the biggest lesson learned is dentistry is absolutely essential. It's the top of the healthcare stack. Everybody here on this call knows, and Norton especially with his business model knows and understands this, but oral health is connected to the overall systemic health. And compromised immune systems can very much exist when there's decay and bacteria in the mouth. And to say that dentistry needs to step aside so that other healthcare providers can step forward, it was absolutely the wrong position to take and again, global, national, and local authorities that took that position, as well as dentists in general. Now, if they personally didn't feel comfortable, I'm respectful of whatever their position is, if they didn't feel comfortable practicing dentistry and those sorts of things. But we now have a year of data to look back at, and it tells us that so far there is not a single reported case of contraction of COVID from visiting a dental office. And that alone says the fear around contraction and those sorts of things, very little to none. And knowing what we know about the role that dentistry plays in the overall healthcare of every single human being that walks the planet, the biggest lesson learned in my mind is dentistry is absolutely essential and never should be considered unessential by any individual or regulatory body again. That would be my take.
Yeah, and important to just know before you take on any transformations or anything like that, just feel empowered to do so because it is essential. So appreciate you sharing that, Ken. Lisa, how about you go next?
Yeah, again, thank you, Ken, for that, because I agree with you 100% there. Patients with gum disease versus without gum disease are anywhere from 3 to 8 times more likely to need to be put on a respirator or even experience death due to COVID. So we do have to keep oral health at the top of the pyramid. Dental was, I think we still are a little bit behind in the perception of how important it is and what our essential functions are, not non-essential, but essential. And the last thing I want to say here is that we found that our patients were hungry for that touchless system of online bill pay, text to pay. Everybody was asking, hey, can I text my payment in? Can you how do I pay online? So if anyone is out there listening and they're not sure, I would say 100%, you need to incorporate this into your business.
Yeah. I mean, even if you just think about it from a consumer perspective, it's something we all want, that capability.
Yeah. It's the first thing I do if I get a bill in the mail is I want to pay it on my computer. I want to just be done with it.
Exactly. All right. Barb, we'll go to you next.
Okay. And Ken, I completely agree as well. I think dentistry is very important. Oral health is sort of the gateway for a lot of other things with our bodies and with our health. So it is important that we keep at the top of what we're doing. As far as some of the lessons we learned that in dentistry, when it comes to infection control and such, we're always very good at that. As soon as a recommendation comes out, we implement that. So it was good for us to take a step back and look at what we were currently doing. And we were doing a lot of good infection control already. So it was easy for us to implement some of the things that went on. And some of the other things that we had implemented as far as, the virtual consults and things like that, it was huge for our patients. They definitely wanted, they wanted to be seen. They wanted us to look at them, especially if they thought that they were having some sort of orthodontic emergency. Could we talk them through how to handle that at home? But also it was important when we talk about dental health to keep an eye on their hygiene. It's important for those kids to make sure that they're at the top of their game with that long term. And people definitely wanted more and more technology. Like I said, we were already doing some of the technology, but this really thrust us into using it completely. And my biggest recommendation would be, if you think you want to do something, take the plunge and do it. Don't just baby step your way into it, because you find that once you actually go all the way and do that, your patients will be very happy. And actually, it made our team very happy as well. It was great for all of us.
Appreciate that. Yeah, I think the phrase I've heard used in healthcare is sort of the pandemic gave folks a license to act, to really innovate. And I think that's what you're sort of getting to there. Is like, if you want to make a transformation, just get after it, go do it. Excellent. So Norton, let's turn to you next.
So it's a little bit repetitive of what especially Lisa and Ken had to say, but the essential service component. Here in New York, and I don't know if anyone else has facilities here, but there was about, I guess, a little bit right around this time last year, there was a bit of a never land of where dentistry stood. We had different, groupings of essential services or less essential services that were established in the governor's office. And here we were in a situation where medicine was wide open, including elective procedures, cosmetic procedures, and dentistry was closed. So we took it upon ourselves to go and visit the folks in Albany, visit the governor's office, and really talked about why this is an essential service and shared the literature with them. And the next thing we knew, we were accelerated. And because prior to that, we were literally in the same category as massage and tattoo parlors. And next thing we knew, we had been given a green light to open. And I'm hopeful that will have a lasting effect on what the perception of dentistry and oral health is from at least our local and state governments. The one other thing that I just want to mention is in terms of, lessons learned. I think that all of us realize that we need to take an even greater interest in the people who support our business, all of our staff, our clinical staff, our non-clinical staff. And, during the course of this pandemic, which of course none of us were prepared for, not something that I've certainly dealt with in my lifetime, and I've been involved in healthcare businesses now for decades, is being sensitive to and being respectful of our staff's individual needs and try to be accommodating to them. I mean, fortunately, we feel like we're coming out of this now, but there were a lot of people who were hurting, and we felt that the more that we could do to accommodate their needs, help them out, make sure that they knew that they could have a job when their child care needs were finally going to be addressed, was really important and did help us build a more unified culture. And so I think that's just true when you have a tragedy, when you have something as awful as a pandemic. It made us all think more about the entire team and not just the business.
Right. The crisis has a way of focusing the mind, right, and prioritizing things, and it turns out that the people are what matter most, right?
And maybe being a bit more humane as we all thought about, what was important in our lives. Exactly.
Yeah. Excellent. Thank you, Norton. Brian, I want to turn to you next. I know that contactless payment was coming up quite a bit, so would love to hear what you have to say here.
Yeah, I don't think I could have said it better than Lisa did, so thank you, Lisa, for that. But I completely agree. The biggest lesson we saw, and we always thought this internally, it's kind of our business model, but we saw the patients want these features the minute they were implemented. We're seeing it over and over and over again. So my biggest advice out there is these features and functions, they don't have to be overbearing. They're not overbearing. It's actually a fairly simple process. There's a lot of good vendors out there. Obviously, Rectangle Health, we believe we are one of them. But there's a lot of great vendors out there to supply these options, and it really will change the dynamic in the provider-patient relationship, which at the end of the day, that's what technology is there for. It's to strengthen the relationship between provider and patient. It's never there to hinder everything the providers do on a day in, day out basis. So like I said, Lisa put it perfectly. The biggest lesson we saw is the adoption rate of the technology absolutely surged during this time.
Thank you, Brian. Appreciate it. And we're going to do one final question here before we get to some audience questions. But I sort of want to ask here, as we sort of creep back to a more normal existence, I want to ask what changes do you see sticking around? And are there any new ideas you've been inspired to tackle? Ken, we'll start with you again.
Sure. So jumping to the health and safety advocate position that we created in April of last year, we have kept that position in place up until today. And we're just barely starting to consider reducing that position in the practice moving forward. But our number one criteria is even though the health and safety advocate position may be eliminated, we have to make sure the spirit of that position resides in everybody that's still going to be there in the dental practice. And so because of that, right, those who are in that role, they're going to end up having opportunities to work in other roles in the dental practice, or perhaps even at our support center, or in other opportunities to make sure that the spirit of that stays alive and stays real. The other closing thought that I had around just how we think about things and how we learn so much about each other as human beings. Dentistry is a service business. And I've looked at a lot of different dental businesses and dental practices. 55 to 65 cents of every dollar that leaves a dental business is going to a human being. It goes towards the labor cost or some benefit or statutory tax associated with them. And what we learned through the pandemic is that the very best way to try to create the best outcome with all of those dollars being spent on all of those amazing human beings, the very best way to create the best outcome is to have an amazing culture and to invest over and over in your culture to create alignment throughout your organization around the mission. I loved how Norton talked about the mission that they have there inside their organization. We have a similar type of a mentality. That's one of the biggest things we learned is there's a way to maximize the output or the outcome or the benefit that the business gets from spending all this money on these people. And it's getting them aligned around a culture and taking great care of patients.
Absolutely. Thank you, Ken. You've had some great stuff to share about building a culture and really taking some of these lessons from the pandemic and ingraining them into the culture moving forward, regardless of what titles exist. So I appreciate those comments. Lisa, why don't you go next?
Thank you. Ken, great lead in to what I'm about to say. It's so true to focus on the people, and what Sage is going to be doing is adding more and more touchless and paperless technology. We're already working on it, but the more that we can automate and use paperless, the more we can focus on our employees, our people, and our patients. So the shift becomes more attention to the people instead of the process, because the process will take care of itself.
That's right. So you're really leveraging technology to make the whole experience more human, more humane, as what's come up here a few times. Great.
Yeah.
Barb, turning to you now.
So Lisa, I'll kind of build off what you said as well with technology. We definitely are going to keep in place, the Zoom link with parents that can't be at appointments, and automation of payments and paperwork and things like that. But we're also looking to implement more virtual consults into our schedule, knowing how busy people can be as everything is returning back to normal. People are getting back to work, kids are getting back to school. How can we get those folks in for appointments? So it's causing us to take a look at our schedule and how do we run our schedule, and how can we make more room in our schedule to see more virtual exams. So we just want to keep looking at technology. Technology is changing so rapidly as we go anyway. We're always looking for ways that we can improve it. And now it's just up to us to say, all right, this is how we're going to do it. And like I said before, take the plunge and get it done so our patients and our staff can all be happy together.
Absolutely. Things are definitely, you can feel things getting busy again. So the convenience thing is so huge. So I appreciate those comments, Barb. Norton, how about you? Anything new that you plan to tackle?
I think folks pretty much hit on it. I guess from our perspective, we sort of look at this as, as the world is now sort of divided pre-COVID and post-COVID, hopefully post-COVID. And, I think that all of these changes that we adopted, both from a technology standpoint, a telemedicine standpoint, and from a service standpoint, there's no looking back. Those are in place and will continue. In terms of new ideas, I think that for us, it's going to be an expansion of medical services being provided in a dental office. And as I mentioned earlier, the continuation of that integration through things like a shared electronic health record, and really just educating the public. I mean, we're big believers in public education about various healthcare services and the advantage of partnering with medical groups whose patient base ranges from as small as 500,000 to as large as 1.5 million, is that it gives us a great opportunity to piggyback on the activities that they have in place. And now, to the extent that, and this is what we've always wanted, I mean, we've only been at this for a little more than 4 years, but we've always wanted to be able to have patients see a physician and a dentist working hand in hand, and both talking about how that through that integration that they will keep their patients healthier. I think that we're on our way to that, and we'll continue to do that as as the tools that we put in place continue to expand. So it's the silos or chasm, as has been described, between medicine and dentistry has existed for far too long. We know that there are pockets of where integrated care has been provided in academic settings, maybe on the West Coast in a Kaiser kind of setting, or even locally in Medicaid FQHC settings. But as we all know, that the majority of healthcare services are provided by community-based providers, and that's where people go to their healthcare. And so we think that we're finally starting to make a change in how the community, the public at large, and most importantly, or just as importantly, the physicians see dentistry as an important healthcare service. So we think there's just no turning back, and the steps that we put in place are the springboard to keep on going.
Absolutely. Thank you, Norton. That was excellent. Brian, what do you have to say on this one before we jump into a couple audience cues?
Yeah, I think everyone knows what I'm going to say. We think it's here to stay. When we think about technology, think about how we transitioned from cash, then we started paying with checks, and then we converted to credit cards, and now credit card owns almost the entire payment market. What's next? And really what's next is these contactless options. We're paying with our phones now. We're paying with our watches. We're going that digital route. So the ultimate goal is, why not be Uber of healthcare? Why can't I walk into Sage Dental, get treatment, and leave? And I would have checked in, I would have paid, I would have signed my consent, and all of that via my phone. That's the ultimate goal. That is where we see the market going, and we do not see it backtracking whatsoever.
Thank you, Brian. And thank you again, Norton, Lisa, Barb, and Ken. It was a fantastic discussion. You all addressed these questions brilliantly. So We'll now begin today's question and answer session with the audience. So as a reminder, you can submit any questions you have by typing them into the Q&A box you see there on your screen. And so let's dive in here. Let's get started. Lisa and Brian, this first one is for you. So perhaps, Brian, you could start us off, and then Lisa could jump in as well. The attendee asks, how is text to pay different from a mobile payment, or are they one and the same?
Yeah, it's a nuanced question. Text to pay is truly the provider can push out a text with a statement, an e-statement, saying, hey, balance is due, post adjudication of $50. It's a one-click pay. You click on what's called a URL, and you actually make a payment on a secure web portal. That is a true text-to-pay option. Then you have your mobile pay, which is, think of Apple Pay, Google Wallet, Samsung Pay. You can pay with your watch. That's more of your mobile option. So it's a nuanced difference, but text-to-pay is a true outreach from the provider. A mobile pay is, I'm going to go pay with my Apple phone or my Samsung or what have you.
Thank you, Brian, for that clarity there. Lisa, any comments about the nuances? Anything else you'd like to share on text to pay, mobile pay?
Yeah, I'm actually glad that Brian cleared that up even for me. We are getting patients text or calling us or emailing us on our website saying, can you send me a text so I can pay my bill now? There's nothing better than that. I mean, we all live every single day with our phone. We're never more than 3 feet away from our phone. So you get that text and you take care of it right then and there. And our patients love it.
Mm.
Absolutely. Yeah, totally. I mean, just again, from a consumer perspective, it just makes a ton of sense, regardless of what industry you're in, right? We'll jump to this next question then. The attendee says, my company is looking at more ways to integrate dental with the overall health of the member. I'm interested in learning more about how you implemented blood pressure readings during routine exams. What was the process? What did you do with the data? What steps were taken if a member was identified as hypertensive? Norton, you want to grab this one, and then Ken, if you have any comments too, I'd be curious what you have to say over something of this type of topic.
Sure. I mean, from our perspective, honestly, we were doing blood pressures pre-COVID, but made that now part as a regimen of tests that included other cardiodiagnostic screenings as well. So I think when you ask how did we do it, the answer is that we, as I said before, started to really embrace our hygienists as our frontline workers. I will tell you that the culture that created, the way that they perceive themselves now as being an important healthcare worker added tremendously to our ability to roll this out. So we do the tests. If there is an abnormal, I mean, I'm not a dentist or a clinician, so this is my basic understanding. You repeat it, make sure it is abnormal. And then, of course, if the patient has already identified who their primary care provider is, we communicate all abnormal results to their PCP. If they don't have a PCP, we obviously, through our affiliations with these large medical groups, can make physicians available to them. But it's really just it's a screening process so that both the patient and their treating physician are aware that we saw something. It's obviously then up to our dentist to decide if that is a showstopper to moving forward with treatment, as it always has been. But it's really, to me, the key is the role of the hygienists and the communication with the treating physicians. Those are the key elements of implementing that kind of a service.
Thank you so much for laying all that out, Norton. We're coming close on time, so Ken, I want to invite any closing comments from you or any comments, further comments about the integration of dentistry and the broader healthcare system. But I want to circle around and get closing comments from everyone before we sign off here. So Ken, we'll start with you.
Sure. I'm really grateful for the opportunity to be here, and these other panelists have been phenomenal, and I've learned a lot from each of them. I think the main takeaway for me inside of our organization we realized really quickly that COVID was going to be what we now call the great accelerator. If we weren't, if we were doing some things analog that could go to digital, it accelerated our thought process in it. There were some things we thought we might not do for 2 or 3 years down the road, and we figured out how to get them implemented in like 6 weeks, just because of the needs of the circumstance and the situation. So my hat's off to everybody out there in dentistry. I think everybody's been innovating like crazy, allowed COVID to be the great accelerator. And for the most part, I think dentistry is better off on the back end of all the lessons we've learned from COVID. Now, I would never wish a global pandemic on anyone or anything, but I think dentistry is better. I think we're stronger. I think we're going to be more resilient moving forward.
Thank you so much for those comments, Ken. Appreciate you being here. Lisa, any closing comments from you?
Oh, thank you, Brian. I just want to say thank you to all the panelists as well. Like Ken said, I've learned a lot from everyone and formed a lot of respect for the different pieces of the puzzle that go together. My advice and my closing comment for everyone is not to get stuck in the old-fashioned ways of dentistry. Let's all work together to move it forward to where we all know it should be.
Excellent closing comment there, Lisa. Appreciate you. Barb, how about you go next?
All right. I just want to say thank you for inviting me to be part of this panel. And I as well have learned so much from all of the other panelists and look forward to potentially working with them as well in the future. And I would say, to piggyback on what Lisa said, technology is moving quickly and we should all embrace it and work together, not be afraid to take that next move and not take a step back, but just continuing to lead the charge moving forward.
Thank you, Barb. Appreciate you being here. And Norton, any closing thoughts from you?
Just really to, again, reinforce first, thanks to Becker's, and really has been a pleasure to share the panel. And I too learned a lot. You know, as I said, I'm new to this business, and one thing which I can tell you that I've learned, dentistry is not just essential, but it's complicated, and it requires a really dedicated team of experts to provide the kind of service that our patients deserve. I think that Ken put it well when he talked about COVID being the great accelerator. I think it has been for us. It's allowed both the public and our patients to understand our mission a little better. And like I said before, for us, there's no turning back. We're busier than we have ever been. We have more medical groups that are interested in our model than we ever have before. And so, again, we hate to think of silver linings and things like pandemics, but I do think that it actually will end up in a situation where we will be better seen as an essential service, and we will continue to stay with that mission and that model.
Thank you so much, Norton. You've had some powerful insights today, so appreciate you being here. And Brian, you want to take us home?
You got it. I've been in this industry a long time, but this past 2 weeks with this panelist has been great. When you hear from industry leaders like Community, Sage, Web, and ProHealth, it's pretty powerful stuff. You guys are doing just an amazing job. My closing remark is really more of a question. Is when you think about your patient's journey and your patient's experience, are we offering them every type of option out there? These technologies, whether it's registration or payment or recurring payments or online bill pay being maybe one of the most easy to access, you will see an instant gratification from your patient base. So my closing remark is, are we offering all the options available? Because they're out there for specifically for dental practices.
Thank you, Brian. And that will wrap things up for us today. So again, thank you to Lisa, Barb, Ken, Brian, and Norton. It was an excellent conversation. It was my pleasure to be here today. I also want to thank Rectangle Health for sponsoring the webinar. To learn more about the content presented today, please check out the resources section on your webinar console and do fill out our post-webinar survey. Thank you for joining us. We hope you have a wonderful afternoon.
Thanks, Brian.